Hello, may I introduce myself? My name is Odile Ullner and I'm from Deutsch for Docs. We prepare foreign doctors for the medical language examination. It's called FSP, and it's very important because without this exam you can't work as a doctor in Germany. And now I would like to have a chat with our old friend. With our old young friend. He is called Wazeem, Dr. Wazeem Shahul, and he was one of our most magnificent students in our courses, and he has passed the FSP exam very well. And now he can tell you how he could reach his goal, in order to work here. We are here where we are here. Oh, perhaps you can explain where we are.
We are right now in Rhoen Klinikum.
Yes.
Rhoen Klinikum is a chain hospital which has many hospital branches all over Germany. And this is one of the main branches. And this is a multi-speciality hospital with almost 700 beds.
Yes.
And we do specific surgeries, like we have a department for shoulder surgery, hand surgery, orthopedics is again divided. Then we have advanced cardiochirurgy, that is heart transplantation, heart operations we do on a daily basis. And I work right now in shoulder chirurgy, that is the shoulder surgery department, with Professor Golke. And after my course in Deutsch for Docs, I got a lot of interviews, and I chose for this because I want to do specialization in orthopedics, and the shoulder joint is one of the most complicated joints in our body, and I find it really interesting.
Yes.
I get to operate on a daily basis, and it all came to be after this course, with this wonderful course with Deutsch for Docs.
Thank you.
That's how I managed to this position right now, and hopefully succeed in it. Yeah.
And are you happy here? Yes.
Yeah, I'm very much happy here.
Yes.
Yeah. We have a very wonderful Arbeitsklima, that is a work environment.
Yes.
Especially for doctors who are coming from outside. We have a lot of doctors from outside Germany, and we all do need to undergo the Fachsprachprüfung.
Yes.
And yeah, I see a lot of my colleagues who still struggle with the language, but zum Glück, I was lucky enough to get a proper course and proper introduction to German medicine with your help.
Thank you.
Thank you so much.
We are very, very happy that we can meet you. And could you give good advice, perhaps for future students who would like to go to Germany? What is very important for them, doctors, I mean?
Most important, of course, the language is the biggest barrier.
Yes.
Yeah.
Yes.
The medical information was what we learned in India is somewhat different to the German system.
Yes.
And the first way to learn this new process is to learn the general language as such.
Yes.
And I would say have a basic German language proficiency. You could start with the German language in India, but then come over, because the way you learn German in India is not enough.
Yes.
Yeah. You are taught like any other subject, like you are studying in the school. But once you come over, and what we did for 3 months, although I had a C1 degree in India, I wasn't able to speak properly in German as I came over.
Yes.
And that made a whole lot of difference doing the course with you, learning German specific for medicine and allgemein Deutsch, the general Deutsch.
Yes, both is necessary.
Both is really necessary.
Yes.
And that gives you a whole lot of confidence. And once you have a really good language proficiency, and you are called for interviews and they see how good you speak, then you get the job
Of course.
directly.
Of course. Yes.
Yeah.
So it's
They see
language.
language is the most important.
important.
They don't check how much
Yes.
medical knowledge you have,
Yes.
or how much erfahrung, work experience you have.
Yes.
Right now I don't speak any English at all. I just speak purely in Deutsch.
Yes. But your German is really wonderful. I think you.
Danke sehr.
Yes. But here, I can see you make very interesting operations. Yes, and you're
Yeah,
quite an experienced doctor here.
Yeah,
Yes?
exactly.
Yes,
Yeah,
yes.
normal orthopedicians,
Yes.
they don't work at such a level.
Oh, yes.
We do
Yes.
shoulder prosthesis on a daily basis,
Yes.
especially complicated cases which get operated outside and they still have problems, and then we take out the old prosthesis and put it in a better position for
Oh.
movement, and such complicated operations we do on a
So
daily
you work on a
basis.
very high
Very
level.
high
yes?
level, exactly. And it's all done with the help of newer techniques,
Yes.
newer CT techniques, MRT.
Yes.
All the newer techniques are compiled together to make the most out of the current technology and give the patients the best possible treatment.
Yes.
That's what we
Yes.
yearn to achieve.
So we
Yeah.
need more specialists to come to
Definitely,
Germany. Yes.
definitely.
Yes.
People who are motivated and they are ready to
Yes.
take up newer challenges.
Yes.
I would
yes.
definitely say,
Yes.
yeah.
So I heard that you have also wonderful gardening or something
Yeah.
kind of park. Yes.
Yeah, we
Is it
do have-
possible to show us around?
Yeah,
For us,
sure.
it's very nice. So you can have a little rest. Would you like to show it?
Yeah.
Yes.